I'm with Dr. Robert Tabash from the Holy Family Hospital here in Bethlehem. Now, Dr. Robert, what is the Holy Family Hospital?
The Holy Family Hospital is practically the maternity hospital of Bethlehem. We are a 125-year-old institution. The hospital is run directly by the Order of Malta, and several associations of the Order of Malta from around the world support this hospital, including the British Association of the Order of Malta.
Now, how far away from the birthplace of Christ?
We are at around 800 meters from the birthplace of our Lord, and we deliver today 70% of all babies born in the whole area of Bethlehem.
Wow. Now, is the hospital a charity or is it run by the Palestinian Authority?
It's run directly by the Order of Malta. It's a charitable institution. It asks people to pay practically what they can afford. Our fees are already fees which are subsidized by the Order of Malta. A small example, we ask people to pay 100 euros for a delivery if they can afford it. And if not, a social worker would immediately look into the case and help them. We also run the only neonatal intensive care unit in the whole district of Bethlehem, and as such, we get all the high-risk pregnancies and all the premature cases of the whole area, and it's quite a costly business.
Now, you are a maternity hospital. How many babies are actually delivered here a day?
10 a day. Last year, we delivered 3,380 babies. So roughly, it's 10 babies a day are born in this hospital.
Well, that's quite a number.
It's quite a number, yes.
Now, you have outreach clinics. What is the aim of the outreach clinic? Whereabouts do you go to?
Well, the outreach clinic is really, the aim of it is to reach the poor at his doorstep, really, those who cannot very easily access the hospital. So we go, including with a mobile clinic, really to the desert, to the Judean desert, looking for encampments of people who are living under tents and shacks and who don't have anything, no sanitation, no running water, no electricity, no medication. And we really reach those people at the door of their tents with a mobile clinic equipped with an electric generator, and it becomes an air-conditioned examination room, fully equipped, including with an ultrasound to examine the pregnant women.
So there are still people today in the Palestinian territories that live in tents and don't have water and electricity?
Yes, unfortunately, it is still the case in some areas.
Now, you have a neonatal intensive care unit. Is that rare for the Palestinian territories?
Well, there are a few of them, but I must say that the results of those units are not the same as here. Our strong point is that we have the trained staff to run a neonatal intensive care unit. We have spent a lot of funding on educating our staff. We've sent them to do postgraduate diplomas in neonatal nursing, for example. And so the end result of that modern unit has been the mortality rate of babies admitted to that unit is 2.9%, which is equivalent to anywhere in the Western world. And by comparison, Al-Shifa Hospital in Gaza, for example, they have a very big neonatal unit. And the mortality rate of babies admitted to that unit is 34%, so 11 times more. The key is education and training of staff, really. We were lucky that US aid and the Belgian government helped us during 2007 with the building of a new neonatal intensive care unit, a new labor ward, a new emergency admission area, and much of also that grant from USAID, for example, went towards the education of staff.
That's good. How many beds do you have here in the place?
We have 63 beds in all.
Now, how many babies have been born in this hospital since the time you've been opened?
Well, as I told you, this is a 125-year-old hospital which ran as a general hospital for 100 years by the Daughters of Charity, who built it and own it up to now. And then they closed down in 1985, and the Order of Malta took over the management of the hospital, transformed it and re-equipped it into a maternity hospital, and opened its doors in 1990. Since that time, we've delivered 42,000 mothers.
Wow. That's quite a lot.
Number, really.
Yeah. Now, is poverty a big issue here in Bethlehem?
Unfortunately, yes, 70% unemployment rate. People really, we have, for example, 140 members of staff. Each salary we pay to any one of them, on average, helps to subsidize members of his family, and on average 18 persons. So rare jobs, unemployment. Bethlehem lives on tourism, and up to now tourism became very rare. Now they're coming back. We're seeing more and more tourists, and hopefully this will improve the situation.
So is the door always open for the destitute and the poor here at the hospital?
Oh, absolutely. I mean, we like to say, quoting a bit from the Bible, or not really quoting, is that this is a place, there's always a place in the inn for any woman who comes in.
So Jesus was born here in Bethlehem and he ministered in this area. So you're ministering today in the same ways that Christ did in the area.
Yes, absolutely. Something else we have to talk about, maybe when I talk about education, we are the only hospital in the Palestinian Authority areas recognized by the Royal College of Obstetrics and Gynecology in London for the training of doctors for the specialty of obstetrics and gynecology. We're also recognized by the European Board and College, by the Royal College of Physicians of Ireland, and also by the Palestinian Medical Council for the training of doctors. So we do participate in the training of future generations of qualified people, really.
So you're a pioneering hospital, really, here.
Well, we're at the edge of maternal and fetal health in the Palestinian areas. We're an example to follow, I guess.
How much does it cost to actually deliver a child here?
The real cost of delivering a child for us is somewhere around $340. We ask people to pay practically 1/3 of that.
Now, if a child is sick and has to go into intensive care, the cost must obviously go up. How much would it cost to keep a child in intensive care for a day, for instance?
Our cost of keeping a child in intensive care per day is $400 or 200 sterling pounds per baby per day. Now, there aren't people who can afford to pay that rate in this area. This is where the funding from the Order of Malta is going all the time.
Is there a big percentage of children end up in intensive care?
Because we are a referral hospital for high-risk pregnancies for the whole area, 13% of babies delivered in this maternity end up in the neonatal intensive care unit.
Must be really nice for you walking around Bethlehem thinking, I delivered this child or I worked with this child.
Well, yes. Over many years, I've been a doctor in Bethlehem for 38 years now.
And you studied abroad as well?
Yes, I studied in France, in Lille, back in the 60s. I was born in Bethlehem and went up for my education and came back, and here I am.
Yeah. Now, you have a chapel here on the ground of the hospital. Is Christianity important for the people here?
Well, this is a Christian institution built by Christians, the Daughters of Charity, run by a Christian institution, which is the Sovereign Order of Malta. And our charity is from our religion in a way. We tend to a majority of people who are Muslim. 93% of the people who come in to get help are Muslim. But we do, the door is open to anybody who crosses that door, irrespective of religion or origin or anything.
It's just showing the love of Christ to the people.
Absolutely. This is how we live the mission.
Now, does political instability affect the hospital at all here?
We've had our share of difficulties and closures and curfews and being shot at, but these days things are quieter.
What's your prayer for the children here in the land of Bethlehem?
The only prayer I can see is that they could have a future in a free and democratic country called Palestine, hopefully.
Okay, Dr. Tabash, thank you very much.
Thank you.